Hello and thanks for joining us. My name is Kathy Traz and I'm the Executive Director of Patient Advocacy at Bristol Squibb. I come to work every day focused on how we can use our resources and platforms as a global biopharmaceutical company to shape healthcare policy, expand access, and improve the quality of care in ways that benefit patients. Pandemic or not, it's hard to navigate a cancer diagnosis, any diagnosis actually, and treatment. So when COVID-19 upended everyone's lives last year, we at BMS and our advocacy partners understood immediately that it would present significant challenges to patients fighting serious diseases. Amidst stay-at-home and social distancing orders, it was clear to everyone in the advocacy community that our typical models of patient support would need change and fast. In a nutshell, the advocacy community needed to fast-track its own digital transformation to continue to fulfill our responsibilities to serve patients. To support this rapid pivot, Bristol Squibb and our partners at GRYT Health teamed up to launch the COVID Advocacy Exchange, a virtual platform to unite patients, patient advocacy organizations, healthcare providers, and policymakers in the shared pursuit of connecting and supporting patients with serious disease. The COVID Advocacy Exchange virtual platform continues to provide organizations, patients, and others the ability to access information and materials relevant to a range of disease areas, including oncology, cardiovascular, hematology, and more, enabling patients to receive vital information and support without entering a hospital and risking exposure to COVID-19. We created the COVID Advocacy Exchange quickly to respond to an immediate need, but it wasn't long before all of us in the patient advocacy space realized that our work had been forever changed by this pandemic. In this session, we will discuss how patient advocacy has evolved amidst the pandemic and explore the opportunities and challenges that these changes bring for advocacy professionals and patients alike, both in the short term and in the long term. So now I'd like to introduce our three panelists, Donna Cryer, Bonnie Addario, and Dave Ure. Donna Cryer is the founder, president, and chief executive officer of the Global Liver Institute. She's channeled her personal experience as a patient with inflammatory bowel disease and as a 25-year liver transplant recipient into a professional patient advocacy career. Previously, Donna founded and led Cryer Health, a healthcare consulting firm. Donna?
Hi, Kathy. Thank you so much for having me.
Thank you for being here. Bonnie Addario is the co-founder and board chair of Go-To Foundation for Lung Cancer and a lung cancer survivor. Since receiving a stage 3B diagnosis over a decade ago, Bonnie has dedicated her life to the fight against lung cancer as an advocate and educator. In 2006, she launched the Bonnie J. Addario Lung Cancer Foundation, which aims to eradicate lung cancer through research, early detection, education, and treatment. 2 years later, she expanded her efforts by founding the Addario Lung Cancer Medical Institute, an international research consortium. Bonnie is also the recent recipient of the Cure Magazine Lifetime Achievement Award.
Thank you, Kathy. It's my pleasure to be here, and thank you to BMS and all of my panelists, and thank you to the patients, because they're the real reason we're all combined today.
Thanks, Bonnie. And last but not least, Dave Ure is co-founder and CEO of GRYT Health, a digital health company that connects individuals with similar experiences and engages them to inform, support, and facilitate improved disease management and patient well-being. Dave tapped into his personal experience as a 2-time cancer survivor and former patient experience researcher to create an app to connect, empower, and transform the experience of living with cancer. Welcome, Dave.
Thank you. I'm honored to be here with you and really excited for our conversation.
So let's get into it. I'd like to start talking a little bit about what the patient advocacy community is for anyone in the audience who may not be familiar with this aspect of healthcare. Donna, can you briefly describe what patient advocacy is and why it matters?
Sure. Thank you so much, Kathy, and I'm excited to be here. Patient advocacy is really about leveraging the lived experience of people navigating cancer and other serious diseases, and infusing that into the development of programs and policy. I think one of my fellow patient advocates had a wonderful definition of engagement that, or rather, it's not engagement unless something changes. So patient advocacy at its core is about ensuring that healthcare changes to serve the needs of patients as defined by patients, of course, in collaboration with others.
Thanks. So all three of you work closely with patients and have deep personal understanding of the patient experience. From that perspective, the patient perspective, what were some of the challenges that the pandemic introduced, and how did you and your organizations respond? I'll start with Bonnie for that first, then followed by Dave, and then Donna. So how did you respond, Bonnie, your organization responds?
Thank you, Kathy. Well, we jumped right in to become a go-to entity for patients that didn't understand the virus or the pandemic. They were afraid. They didn't know how this was going to affect their own health care. And, they were crazy, chaotic times. We are very fortunate to have a virologist working for us that dove right in to becoming the resource for patients to learn all they needed to know about the pandemic named COVID, including what they could expect regarding their health care. Fortunately, we already have a program called The Living Room. That is a patient and physician education program that is live streamed once a month around the world with a guest speaker that talks about lung cancer treatment, diagnosis, early detection, patient programs, and research. We immediately pivoted to making it a COVID learning program with our virologist leading the way, Dr. Amy Moore, who's a PhD in virology. Who knew, right? Because when we hired her to be part of our scientific team, but really kind of, the virology part got lost in the way. Everyone loved it. The patients loved it. We've reached 143 countries with this program, so it was perfect fit for the situation because COVID and the pandemic was something we all have in common throughout the world. Amy and other guests helped our patients manage their care as well. We also outsourced our patients to other communication programs to get even more answers for them and about COVID, vaccination, etc., in their particular areas. So it became a go-to entity, and we're still doing it today.
That's amazing, Bonnie. Thank you very much. And Dave, how about you? How did GRYT Health change?
Well, the first thing to acknowledge is just how scared we were. And, the pandemic settling in was like having another diagnosis, and fear is a big part of that. And so acknowledging what we were facing was the first thing we felt. I believe in an expression I heard early in my career that is our ability to change a situation is directly proportionate to our understanding of it. And so we set out immediately to really learn what was happening. And what we found was that much of what COVID was doing is similar to things that patients either in treatment or facing a diagnosis were dealing with already, being immunocompromised, having to stay away from others. These are things that patients in the community are familiar with. And so we wanted to see what things were being done in specific areas that could be applied more broadly. And then the second thing we did was identify the new ways we were being affected and how could we collaborate and learn from other advocates in other disease areas to move as quickly as possible into change that addressed what we were going through.
Yeah. And Donna, how about you? How did your organization respond?
I believe that the Global Liver Institute was uniquely positioned to respond. We had several advantages. One was that being a global organization, we had relationships in China, in Europe, and so we were preparing and getting signals and information in January and February so that by the time March came around, we could launch our program in advance of a lot of other COVID response programs. We were already stocked with masks and hand sanitizer and a knowledge of several precautions that now people are taking the world over. We were also positioned because we were, founded by a patient, and we're very inclusive of patients and caregivers working on staff to work remotely. So flipping that switch to working remotely was very easy for us. We already had that infrastructure in place. And so our COVID response program started very early, realizing that patients had questions and needed answers even before the medical societies and the physicians had come up with a plan. And so we were there to answer that. Our main challenges and changes during this time have been to transfer our travel budget to a technology budget, our in-person education to virtual education. So really taking advantage of technology to reach patients where they were with actionable information and answers to the questions that we're evolving with such a rapid pace. And so that's really been the core of our COVID-19 program in 2020 and moving into 2021. It's evolving to meet the new needs of patients today.
And Bonnie, I guess for you too, how's the pandemic changed the way you're thinking about meeting patient needs going forward and the lasting impacts that, this past year will have on your work?
That's a great question, Kathy. It's made us all better. It's totally made us all better. And there's nothing like a crisis to, really pull out the big guns and be more innovative and creative about getting the job done, because patients can't wait. People can't wait. We had more options for telemedicine visits for both continuing patients and new patients. You're going to hear me say telemedicine over and over and over again, because we're going to take that into the future in a big way. Making research more flexible and accessible, remote care for clinical trial patients, including remote consent to the trial, doing a lot more over the phone and over laptops and using technology, like Donna said, to get the job done. Bring care to patients in their own homes. Bring clinical trials to patients in their own homes, letting them sign all of the paperwork they need to sign and do remote consent using telemedicine. More options for at-home treatment, including the underserved who cannot travel. Now we can reach them through a laptop and get them everything they need that they would have received had they been able to actually drive to the hospital. Collecting specimens at the patient's home, including blood draws. We send out phlebotomists to go draw blood so they can stay in their trial, because those specimens are needed to track the trial. Telemedicine is here to stay, but will never replace our live conversations and patient visits. But now an important number of visits will be done by telemedicine. I could keep going and going and going because, COVID has been such a difficult thing for everybody to process. But the learnings that we are taking out of this whole pandemic are going to change healthcare forever.
Yeah, Bonnie, I agree. A lot of learnings for sure across the board. Dave, let me hop to you. So even before the pandemic, you were a digital pioneer in patient advocacy. What needs to happen to ensure, in your mind, that the current digital transformation of patient advocacy is successful and really truly benefits patients?
Thank you, Kathy. We, GRYT Health, moved into digital and virtual environments in 2018 before this current pandemic was on us. And I can't emphasize enough, our motivation for doing that was a story that our chairwoman, Shelley, relayed to us before that. She's an advanced APL leukemia survivor, and she remembered walking around the leukemia wing just trying to get her strength back and seeing a flyer for a physical conference and just feeling inside, there's no way I can get there. I don't have the energy and I'm immunocompromised, and I won't ever be able to participate in that. And she felt left out. And that really became for us a rallying call to learn what we could do to meet people where they are and to address these issues. And fast forward 2 years to 2020, when the pandemic hit, all of a sudden the world was facing what we as cancer patients and other disease survivors know. And we took that to always keep in mind that regardless of the scale, it is individuals on one side in their life who are looking for and need support. Public health really starts with personal experiences. And so we keep that in mind in everything that we do. And now, looking at programs that we've done, like the COVID Advocacy Exchange and the Global Virtual Cancer Conference, and these things that we're incredibly proud of, they always start from and stay connected to the individuals on the other side of the technology. And so just simply, my advice is anytime we're using technology or a new medium or anything to support patients and advance patient advocacy, it has to change someone's life on the other side to really be meaningful and sustainable.
Yeah, that's a good point. And I think, going from there and considering the impact, Donna, what are some of the challenges, short or long term, that the advocacy community is going to need to solve?
Well, I think that, Bonnie raised a fantastic number of issues that need to be supported by sustainable policy. So often advocacy is equated with policy, but as we all know, it's just one aspect. But for us, it really is a leading aspect. And during the course of the pandemic, the number of issues like telemedicine, which I would just hope in the future is just called medicine, that we have added to our policy agenda, have expanded. As we worked, we actually launched in addition and in parallel to our COVID-19 program, Pediatric and Rare Diseases Council. And when combined with the pandemic, it brought us unique insights into the needs of children, parents, families in communities, and everything ranging from housing to nutrition to be able to keep themselves safe, in addition to how to access care during a pandemic. And so our policy agenda expanded. Our number and type of collaborations expanded exponentially over the course of the pandemic. And Bonnie's right, it's made us stronger, it's made us better, it's sensitized us, and enabled us to provide a more whole person policy agenda, making sure that there is diversity, equity, and inclusion, or diversity, equity, and belonging, which I like even better as a term, so that communities of color who have been disproportionately impacted by COVID are better served by not only COVID vaccination, but clinical trials, by care. I think that this is an opportunity, if we make it one, and meet the moment, to evolve what has been surfacing as both lessons and acceleration of application of things that patients have been wanting to integrate into care for so long, like decentralized trials and care at home, and both audio as well as visual telehealth advances, to make sure that those reach every community, and that the outreach that we're doing, or done by governments everywhere, on COVID education and COVID vaccination, also include liver health, is how our program is evolving and changing the impact that we can have very deep into diverse communities.
Yeah, Bonnie, I guess for you, as Donna said, a lot of the patient advocacy works come from communication and, through partnerships. So why is the cross-sector collaboration so important for this work, and how do you see it benefiting patients as well?
I think it's huge. we are all doing good work that translates to patients, but we could do more by collaborating with each other. No one has all the right answers and or the right processes. By sharing those, what works and what doesn't work. We need to share our ideas and projects that work. I used to belong to Faster Cures in New York. And what we were a group of very different diseases. And the whole idea of Faster Cures was to bring us together for us to share what worked and what didn't work. At times, failing faster was as good as progress. A penny saved is a penny earned. And sometimes we stay involved in a project way much longer than we should. And it's great to have collaborators that you can just pick up the phone. Donna and I have collaborated over the years, and I'm going to be reaching out to you, David, as well. We have a mantra at our foundation. Before we start anything new, regardless of how cool it sounds for us to share, we ask ourselves, is this good for the patients? There have been times the answer was actually no. It's a really cool idea, but it's really not going to translate to patient care. So we don't do it if it's not. Collaboration and communication are keys to success. One of my favorite quotes about communication is, everybody assumes that it's happened until you realize it really hasn't. Imagine if you are a collaborator and your share saved the life of a patient in another disease. Now, that's a good day, right? That's a good day. I would love to be put out of business someday because there was no disease anymore. This one thing I know for sure is we are all better working together.
I couldn't agree more.
I think we all agree with that, right?
Yeah.
And I guess continuing on that, Dave, talking about partnerships and togetherness, let's go back and talk about the COVID Advocacy Exchange. Can you share a little more about the impact this program's had and what you think made it so successful?
Yeah, be honored to. It really came from a place of learning. And the first thing that we did was talk to our fellow advocates and listen to the ways the organization and the patient communities are being affected. And from that, we co-created a program together that dealt with those issues by bringing people together from around the world to solve them collaboratively. And just as one example, one of our earliest sessions was about the best practices for going virtual. How do we take all the things that were planned in physical environments and move them to virtual, and getting to share the things that our team at GRYT Health had spent time developing and interacting with others. We got to share those practices. And, we've heard now just in the last couple of months from organizations that say how much that insight really changed the year for them, because they were ready to run instead of crawl had it not been for those interactions. And we hear that in all the areas that we've come together. And so just, simply put, it's about listening to each other. And what Bonnie said about collaborating, we all go further together, is what it's all about.
I agree. And I think I'm starting to hear the theme, right? I'm starting to hear the theme. So to wrap up, I'm going to ask all three of you the same final question. If you had to choose one word to describe the future of patient advocacy, this is a tough one, what would it be and why? So maybe Bonnie, you want to go first?
Sure. This is very simple, and we all just said it. Collaboration is the one thing we can all do together to push this forward. Why? Because it's clearly the right thing to do for the patient.
Donna?
I would use the word connection. Slightly different from collaboration, but connection, because that connotes the digital connection, the connection between organizations and patients, and the connections between patient advocacy organization leaders that has been facilitated accelerated during this time. So although COVID has been seen as a time of isolation, I really feel that it has made us more intentionally connected. And I hope that that is the future of patient advocacy.
Excellent. How about you, Dave?
For me, it is co-created, and building on what they both just said so eloquently. Regardless of where we are as patient advocates, whether it's just finding our voice to advocate for ourselves or a part of policy advocacy or using digital health to support our communities, wherever we are, these are complex and really big things we're tackling. And by co-creating the path forward, we will all move better together.
There's so much more we could discuss on this topic, but unfortunately, we have to end today's conversation here. Thank you again to our wonderful panelists, Donna Cryer.
Thank you, Kathy. Thank you to my fellow panelists. And if anyone is interested in knowing more about our COVID-19 response program, please visit us at globalliver.org.
Thank you, Donna. Bonnie Addario.
And I would love for you to visit me on our website, which is go-to-foundationforlungcancer.org.
And Dave Pure.
Thank you very much. And we would welcome anybody to learn more about our GRYT Health programs or the COVID Advocacy Exchange we spoke about at grythealth.com, spelled GRYT.
In challenging times like this one, there's so much changing. Patient voices matter more and more than ever before. All of us at Bristol Myers Squibb are grateful for the opportunity to partner with each of you and your organizations to keep patients' needs and experiences at the center of everything we do as a company. So thank you very much.